Hey everyone, it's Felicia here and welcome back to my channel, taking you through my journey as a medical mom and my little one who has a rare genetic disorder called Pfeiffer Syndrome. And this is part 2. So if you haven't watched part 1, check it out. I go all through how I found out about Pfeiffer Syndrome and what is Pfeiffer Syndrome. Today, we're going to talk about the treatment. So in part 1, I share how there is no cure, there's just surgeries. So we're going to dive into all the surgeries. Through our hospital, we did things a little bit on the innovative side. So as you'll read through, Pfeiffer Syndrome has the set surgeries that most of the kiddos have who have a little bit more severe case. And they usually do them at 3 months, 6 months, 9 months. There's a certain timeline. But for my little one, we were ahead of the curve. So in order to get in front of any things that might kind of arise later on, we did them early. So instead of waiting until 3 months to do certain surgeries, we did them at 6 weeks. And it has made the biggest difference. It has allowed her brain to grow and have space. It has allowed her to thrive. So the first surgery she had was a tracheostomy. So as I shared that she has some breathing complications, mainly due to her craniosynostosis. Her skull grew upwards and it made some fusion in some really small airways when it comes to her nasal bridge, and her underdeveloped jaw pushes back, so she's got a very small and narrow pharynx and larynx back there, okay? So that means she has issues breathing through her mouth and her nose. So then what do? You get a tracheostomy. So that has created a stoma. A stoma is just an opening. We call it her stoma right here. It's an opening right below her vocal cords, and that is where her trach sits. So that serves as her mouth and her nose. She breathes through her trach. So funny story, at one point there was a blanket on her face and I remember pulling it off like, oh no, it's gonna suffocate her. Well, she breathes through the stoma. So as long as this is not blocked and covered, then she can breathe. So that is why it's so key for us to continue to suction and make sure her airway is cleared through her stoma, because that is how she breathes. She's also connected to a vent. Her vent helps put pressure and air into her lungs, into her bronchi, so it doesn't collapse on her. So it gives her pressure on her inhale and her exhale. And that is just until her lungs get strong enough to do them on her own. But she does take her own breaths. She initiates her own breaths. And her brain tells her body to breathe, so she doesn't have any apnea. But with the trach, you have to think about it in the sense that she cannot clear her secretions. And so as we might have saliva coming down, we might be able to cough it up or swallow it. She doesn't have that function. So we have to manually suction her. And if you check out my video about her machines, you will see her suction machine and understand what I'm talking about. So yes, she's got a trach. And think about it in this way. So her tracheal sleeve, or trachea, is about this big, okay? But she has to breathe through a trach, which is about 3.5 is what she has. And so it's very small. It's like breathing through a straw. So that's why it's so important to keep that straw clear, that passage, that airway clear for her, okay? So she had that done at 6 weeks. And then she had to just be still. She was sedated. She could not move. We had to make sure that it healed. And for her, unfortunately, she had a kind of odd reaction to it, because if you think about it, there was a foreign object being put in her at such a young age. So her body wanted to reject it. So we need to give her body a chance to respond to it. So she had an increased amount of secretions because her body was trying to push it out. Once her body settled, the secretions calmed down. Her next surgery was her craniectomy. So with craniosynostosis, you have fused skull sutures. So what do we have to do? We have to open all of those up because we want her brain to grow. So the craniectomy was taking bone from her skull. So think about wearing a headband. The headband goes all the way around. That is the type of bone we removed. All the way around her skull in a headband shape, and the bone regenerates on its own. So we created soft spots for her, but we created them along the lines of where those sutures and those planes fused. So the goal was to have that bone regenerate at a pace that her brain would also continue to grow and her skull would grow. And it's done a great job. So the bone is almost pretty much all the way grown back, and she had that surgery around 6 weeks, and now she's close to 8 months old, and that bone is back and it's strong, and we've seen the difference by being able to give her space. So we've had MRIs and scans to see the space that she has. So she has about 1 centimeter of space, and so now it's time for another surgery. And it's like a little quiz, but for most kiddos, your skull doesn't fuse all the way until you're 2. So what we're trying to do is create that fusion by removing bone all the way up until she's 2 to give her that space. So the tracheostomy and then the craniectomy, those are the 2 big surgeries she had to help her with brain development and for her breathing. After that, if you can imagine, if you do not have a capacity to breathe through your mouth, you have that blockage, then swallowing has to be difficult as well. So Kalia had a G-tube placed. That is where she receives her food, and that is how she's able to grow to be big and strong. And the G-tube was pretty much a little tube placed in her stomach, and there's a port that comes on the outside where we allow food and milk to flow through into her stomach. And this is to get in front of her possibly failing to thrive, failing to grow, by making sure she has the right nutrients in her body, because we can control that through her G-tube. So when she gets to a point where she can breathe better and where she has that open airway, then we'll start to work on swallowing and receiving food orally. So we've got the tracheostomy, we've got the craniectomy, and we've talked about her G-tube placement. If you want to see how she receives food and her feeding, I have a video up, and check that out, and you can see how we give her milk. And it's a very unique way that most families have not seen. So check out how we do her gravity feeds and prime her bag in the video that I have up. Her other surgery is due to her craniosynostosis. So she has hydrocephalus. Hydrocephalus is fluid on the brain, and so it's very common in craniosynostosis and other syndromes as well, but pretty much her cerebral fluid does not flow, and it does not be absorbed naturally like ours does. So we had to flow it and place it somewhere else. So she has a shunt placed in. So it is a long little tubing that goes in her ventricles, in her skull, in her head, in her brain, and it goes all the way back down here through her neck, all the way into her abdominal cavity, and her body just soaks it up from there. And there's a setting on it that we can control through a magnet, which is pretty cool. So she doesn't have to go under to change the settings and change the flow, but we can do it through a magnet and go to the hospital for that. So that is something that she will have to live with for the rest of her life. There is revisions that can happen, and there will be things that we watch out for. So when you have hydrocephalus, there are certain signs to know that, that it's not draining properly. Headaches, vomiting, irritability. And so as a baby, we have to be very observant and making sure that we're watching her on that. As she gets older, she'll be able to tell us, I have a headache, I don't feel so well, and we can be able to see if that's the hydrocephalus and maybe the revision needs to happen, it's not draining properly, or if it's something else. And with that surgery, it's very unique. It was one of those where they placed it in the back of her skull, removed some hair to be able to put it in, and we can feel it. You can kind of slowly feel it too, as it's a little tubing all the way down. But it's a lot of kiddos have it, and I've been able to build a community of kiddos who have hydrocephalus and understand some of the complications behind it and what it means to have it. All right, so what's the next surgery? So she has forward seeing eyes, and so we had to have a surgery to sew the corner of her eyelids together, and this is something to protect her eyes, to protect them from not being able to close properly, from drying out, as well as we put lubricant in her eyes every 4 hours, and it's tracheostomy is what the surgery is called, and just sewing the corner of her eyelids together is pretty much what it is, and it's all about protection. So once she has that big surgery in about 1.5 years called monoblock, that is when we'll give her eyes protection and open up her airway. So that's the big surgery we're working up to. This surgery it's pretty amazing. You should look it up, but it pretty much takes a strip of bone out and it pulls the forehead forward, pulls the nasal passageway bridge forward, as well as the jaw. So those issues of the obstructed airway that she has will be able to be fixed with that surgery. And you slowly, over the course of weeks and months, you kind of like dial, there's a little dial that slowly opens and opens up, and there's a halo that she'll have to wear that pulls the bone forward. And I don't have many answers to that because we haven't gotten to that process, but that is the big surgery that we are looking forward to, and that is pretty much down the road for us to really help with some of these earlier on complications she's having as far as with breathing and eating. And people always ask me, will the trach come out? That is the goal. With that monoblock surgery, we'll be able to see how she breathes with the trach capped with the air valve, and that little air valve will help us push air through her vocal cords. Instead of coming out through her trach and her stoma, it will push it through her nose, and we'll be able to do a sleep study test and a test on her to see how she's responding to breathing out of her mouth and out of her nose. And just like everything, she'll have to get trained and get used to it. So it's not one of those surgeries where it happens and the next day the trach is out. It is a process, and that is what Pfeiffer Syndrome is all about. It's pretty complex and there's layers, but these kids are resilient, they're fighters, and that is what she is. Clea is a strong little girl, and she continues to battle through everything that's put in front of her, and we're on this journey with her. This is not something that it's a one quick fix. It's something she'll have to live with, and with supportive parents and the supportive community, we know that she's going to do amazing things. She's going to thrive, and she already is. She's already showing us what it means to persevere at the young age of 8 months old. She's pretty amazing, guys. And so we thank you all for just being a part of this journey, and we'll continue to document the surgeries that she has. But again, it's all around that skull and getting that good brain development, and then the big surgery at 2.5. And after that, it's really responding to her body and to her needs. And that is just one thing we have to do day by day, is just respond to what her body tells us. And every kid is different. Every Pfeiffer Syndrome kid doesn't have to go through all the surgery she has. Some more, some less. And that's kind of the beauty and the hardship behind Pfeiffer Syndrome, is that there is really no outline and perfect little timeline box to go by. You really have to think about every kid, because every kid has strong genetics and genes from their parents that might make them go this route, this journey, and different from another kid. So that is my reason is showing you her journey and her timeline, is to understand what she's going through versus others. So thanks for joining me. We'll be back with another Pfeiffer Syndrome as I know it, but check out the rest of the videos and subscribe down below for more.